Hello, I'm Raymonda Adams. I'm a certified lactation consultant and doula, and this video is about breastfeeding under special circumstances, brought to you by the UB Maternal and Child Health Program. Breastfeeding under special circumstances. Certain health problems in babies can make it harder to breastfeed. Breast milk and early breastfeeding can provide great health benefits for you and your baby. If you are unable to breastfeed directly due to special circumstances, breastfeeding indirectly using a cup or dropper is ideal. Jaundice. Jaundice is caused by excess bilirubin in the blood. Bilirubin is an orange-yellow substance made during the normal breakdown of red blood cells. Bilirubin tests help determine the health of the baby's liver. Bilirubin results in a yellowing of the skin and eyes. It is actually very common and affects most newborns usually between the second and third day of life, and it clears up by 2 weeks of age. There are two types of jaundice that affect breastfed infants. There is breastfeeding jaundice and breast milk jaundice.
Parents of new babies have been asking me some colorful questions about whether they need to worry if their infant is jaundiced. Well, I don't want to be yellow-bellied on this one, so let me provide some information. Jaundice is the yellow color that appears on baby skin shortly after birth due to the buildup of a chemical called bilirubin that, when it gets to high enough levels, turns the skin yellow. Is bilirubin dangerous? Not at normal or even slightly higher levels, but when it gets very high, that color can get into the brain and cause brain damage. So the name of the game is to keep the bilirubin levels lower. Why do they go up in babies? Well, in all of us, we have livers that are working quite maturely and can break down this chemical. But babies have new livers that don't handle the chemical quite well, so the levels will build up. How do you know if your baby is jaundiced? Well, before you take your baby home from the hospital, they're going to check the level of the jaundice with a device that measures it off the skin or a blood test. But if you're home with your baby and your baby's starting to look a little yellow, well, press your finger on the baby's nose or their forehead. And if the skin turns white underneath where you're pressing, the bilirubin level is probably not that high. But if it stays yellow, contact your baby's healthcare provider. He or she will want to see the baby, recheck the level. And if it's elevated, well, they're going to have you come into the hospital, or they may give you a device that allows your baby to undergo ultraviolet light, which breaks down this chemical and prevents the bilirubin levels from going high enough to affect the brain. In addition, your healthcare provider will encourage you to breastfeed your baby as much as possible because hydration also keeps the levels of bilirubin lower. If it turns out that phototherapy, which is what we call this technique, doesn't work, your child's doctor has other ways to help lower the level to protect your baby's brain. So that hopefully tips like this will do more than skim the surface when it comes to knowing a little bit more about what you need to know regarding your baby's jaundice. This is pediatrician Dr. Lewis First from Vermont Children's Hospital of Fletcher Allen, reminding you to always be first with your kids. Parents of new babies have been asking me some colorful questions about whether they need to worry if their infant is jaundiced. Well, I don't want to be yellow-bellied on this one, so let me provide some information. Jaundice is the yellow color that appears on baby skin shortly after birth due to the buildup of a chemical called
Breastfeeding jaundice. Now, breastfeeding jaundice occurs when a breastfeeding baby is not getting enough breast milk. However, it is not a problem. It usually quickly clears up with more frequent breastfeeding or feeding of expressed breast milk. The levels can be monitored with blood tests or controlled through treatment. And the most common treatment for jaundice is phototherapy. Phototherapy is conducted with a special lamp called a Billy light. This lamp helps to break down the bilirubin in the baby's blood. Breast milk jaundice. Now, this type of jaundice is very rare and affects less than 3% of all infants. The exact cause is unknown. It may be linked to a substance in the breast milk that prevents certain proteins in the infant's liver from breaking down the bilirubin. It is safe to continue breastfeeding your baby. It's a temporary condition that shouldn't interfere with the benefits of breast milk. And additional breast milk may help your infant pass the bilirubin in their stool or urine. Reflux disease, GERD.
It's a common disease that impacts babies and children. GERD stands for gastroesophageal reflux disease. And what this implies is individuals who have problems with gastric contents that move up into the esophagus or into the mouth. Infants are prone to having reflux until their gut starts to mature around 12 to 18 months. But doctors say GERD is more than just reflux. So it's important to differentiate between reflux and gastroesophageal reflux disease. Reflux just implies the contents move up and down between the stomach and the esophagus, but they don't cause any problems. To diagnose GERD, doctors will look for red flags like, is the baby vomiting so much that it's impacting their weight? Or is it disrupting their eating before and after meals? Diagnosis is based on not only the symptoms, sometimes it's just doing an empiric trial of medication to see if the symptoms get better. More severe symptoms doctors see in children can include erosion to the esophagus, swallowing problems, or bleeding in the throat. The most common symptoms are probably after eating, and that can include the regurgitation or burping up of contents. If left undiagnosed, it can impact the child's daily life and lead to other problems as the child gets older. Another thing that we see is very common foods that tend to lead to more problems. So, for example, spicy foods or pizza, tomato products, all of these things can also lead to reflux symptoms in the susceptible person. To manage the symptoms, doctors may prescribe daily medication or a diet change until the child gets older. For Lee Health, I'm Lindsay Fry.
So let's talk about reflux disease or GERD. Gastroesophageal reflux disease, or to put it simply, acid reflux, occurs when the muscular opening of the stomach opens at the wrong times. This results in milk or food re-entering the esophagus. Some symptoms of GERD is gagging and swallowing problems, severe and frequent spitting up, inconsolable crying, and a refusal to eat. Around 25% of babies have some degree of gastroesophageal reflux, ranging from mild, where they painlessly spit up numerous times daily, to severe, which causes abdominal pain, waking at night, and colic symptoms. Babies might have some of these symptoms and not have GERD, so it's important that you see your baby's doctor if he or she spits up after every feeding or has multiple symptoms of GERD. If your baby has GERD, it is crucial for the mother to continue to breastfeed. Breast milk is always easier to digest than infant formula. Another circumstance is called colic or crying. Colic. Colic is frequent, prolonged, and intense crying or fussiness in an otherwise healthy infant. It usually starts between 2 and 4 weeks of birth. Symptoms include a predictable timing of crying each day, intense crying for no apparent reason for up to 3 hours or more per day, for 3 days or more per week, for over 3 weeks. Facial discoloring when crying, and bodily tension when crying. The exact cause of colic is unknown. Infants born to mothers who smoked during pregnancy or after delivery have an increased risk of developing colic. So see your baby's doctor if your infant experiences excessive excessive crying or multiple symptoms of colic. These symptoms can be related to other illnesses such as GERD. Possible treatments for colicky babies are swaddling or holding the infant with a baby wrap, changing the infant's diet, soothing baby with sound or motion such as a swing, a rocker, fan, vacuum, or a white noise machine. Try giving baby a warm bath or placing a warm bottle on his or her belly. Colic almost always goes away on its own by 3 or 4 months, and in rare instances by up to 9 months. Let's talk about premature and or low birth weight babies. Premature birth is when a baby is born before 37 weeks gestation. This often results in low birth weight, less than 5 pounds and 5 ounces. Low birth weight may also be caused by malnourishment in the mother. Premature babies may not be able to breastfeed right away, but they can benefit from expressed milk. And premature babies may need more skin to skin contact with parents or more frequent feedings. Expressed milk can be given to the infant through a feeding tube if you leave the hospital before your baby. Skin to skin contact can be very calming and a great start to your first feed. Cross cradle holds help premature babies latch properly.